Hello guys, we are going to look at another topic on from medical surgical nursing on liver cirrhosis. A topic from medical surgical nursing on liver cirrhosis. In the other class we talk about hepatitis. And we say that if hepatitis is the inflammation of the liver. The hepatitis can be subdivided into acute and chronic hepatitis. Acute hepatitis may be treated or it may subside in case of self-limiting hepatitis. When there is self-limiting action of the disease. In chronic hepatitis, when the hepatitis has been in the body for a very long time, it can result to the complication of hepatitis, such as liver cirrhosis, liver cancer, chronic liver disease, or end-stage liver disease. We'll look at liver cirrhosis. What is liver cirrhosis? Liver cirrhosis is a chronic liver disease that destroys the structure and function of the liver lobules. The structure and function of the liver lobules. In liver cirrhosis, the structure of the liver are destroyed. The function of the liver, such as detoxification, deamination, metabolism, are no longer there in case of liver cirrhosis. What are the causes of liver cirrhosis? Liver cirrhosis is caused by alcohol abuse. It's common among people that abuse alcohol. It's common among people that take alcohol without any limitation. Another one is hepatitis B and C. Chronic hepatitis B and C can result to liver cirrhosis. Then drugs can cause toxic liver damage. Example of these drugs like paracetamol, tetracycline. Then heart failure can also cause liver cirrhosis. Obstructed bile flow or biliary cirrhosis can cause liver cirrhosis. Then we have autoimmune process can also result to liver cirrhosis. Hepatic infiltration is another cause. The signs and symptoms of hepatitis, of liver cirrhosis. Signs and symptoms of liver cirrhosis include dyspnea, enlarged liver in the early stage, enlarged liver, that is hepatomegaly in the early stage, and the liver will later shrink in the later stage. In case of hepatomegaly, it is obvious in the stomach. The patient usually have big stomach. And we have splenomegaly, enlarged spleen, esophageal varices, abdominal pain. Another sign is anorexia, nausea, ascites, clay-colored stool, peptic ulcer, gastrointestinal bleeding, hemorrhoid, hepatic encephalopathy, paresthesia, sensory disturbances, bounding pulse, portal hypertension, increased risk for bleeding, decreased clotting factor, thrombocytopenia. Another signs and symptoms, others, we have anemia, oligomenorrhea, that's scanty menstruation in female, testicular atrophy in males, gynecomastia in males, jaundice in the sclera, skin, erythema of palm, spider angioma, decreased body hair, pruritus, ecchymiosis, fluid and electrolyte imbalance, hypoalbuminemia, hypocalcemia, malnutrition, generalized edema, susceptible to infection. The complications include esophageal varices, portal congestion, hepatic encephalopathy, renal failure, aside, portal hypertension, liver cancer. The management of liver cirrhosis. The history taken, history of the alcohol consumption, drugs, concoction. Also take history of liver stone, kidney stone, gallbladder stone, injury, history of nausea and vomiting. Ask patient about possible exposure to hepatitis, including recent travels, close contact with someone that has hepatitis. Physical examination include the paleness, observe patient for paleness and jaundice. The lab investigation include test the patient for hepatitis A and C, hepatitis B and C, which usually result to chronic hepatitis. The X-ray, radiological studies to include viewing taking X-ray of the patient to view the size of the liver, the size of the liver. The medical management, medication, substances that are toxic to the liver, example, alcohol, paracetamol are avoided. Drugs that are metabolized in the liver also should be avoided in the medical management. Example of these drugs include barbiturates, sedative and hypnotics. Diuretics are ordered to reduce edema and acid. Example, spironolactone. Drug to reduce blood ammonia level. Example, lactulose, neomycin. Antacid to manage gastritis and upper gastrointestinal bleeding. Propranolol to reduce portal hypertension. Dietary and fluid management. Advise clients to abstain from alcohol and herbal concoction. Restrict protein consumption if serum ammonia is high. Sodium intake is restricted to reduce edema. Limit fluid intake to control acids. Patients who are placed on nil per oral may require total parenteral nutrition. Vitamins and minerals are ordered as indicated. Example, thiamine, folate, vitamin B12. Fat-soluble vitamin, vitamin A, D, E, and K may be given in water-soluble form. If this is not well treated, surgery may be done. Liver transplant, parencentesis, removal of fluid from the peritoneal cavity to control aside, transjugular intrahepatic postosystemic shunt, transjugular intrahepatic postosystemic shunt tips. This is done to reduce portal hypertension. Thank you for listening, for watching. Always like, subscribe, make comment, or ask question in my comment section. Feel free and I will answer your question or get back to you in the next lecture.